firm believer is, if you can't be healthy at work if you're not healthy at home, and so it's continue to not lose focus on my wife and our three amazing children.
Welcome to the 2 Cent Dad podcast, where we interview dads to discuss their journeys of intentional fatherhood while doing work they care about and living a life of purpose. I'm your host, Mike Sudik.
So today on the podcast, we have Nathan Baar, who is a father of three. He's also the founder of Baar, which is a nurse-driven healthcare movement, and excited to have him on the podcast to talk about not only his startup and how it's affected his fatherhood life and routines, but also talk about what they're building at Baar and how they're disrupting and playing a role in, I think, what is coming down the pipe in the healthcare industry. So welcome, Nathan. Nice to have you on the show.
Yeah, morning, Michael. Thank you.
Yeah. So you you're a father of three, which is why you're on this podcast, partially. But you're also doing some really cool things with Baar, and I wanted to ask you, it's a nurse-driven healthcare movement, which is really, I think, in our past conversations, you talk about kind of a return to a brown bag kind of doctor style, right? So. But I wanted to just hear how you pitch it, how you talk about it, and we can go from there and kind of dive into where it plays a bigger role and kind of what's happening in the healthcare industry.
Yeah, of course. No, so I'm a registered nurse myself. It's kind of where, from my experience at the bedside, taking care of individuals through their various needs. I practice in the emergency department when I started out my career. So a lot of people think the ER is this high adrenaline, rush all the time, and it's really not. We did a lot of population health management. We were a critical access point for really a community to access healthcare. And you think about it, and you're like, why is the ER that? Why does it have to be that resource? Don't we have primary care and other healthcare access points? And so I was just doing my job as a nurse and just focused on taking great care of people. And then I kind of started to ascend the ranks in the hospital system, became the director of emergency and urgent care services for what was Metro Health, now University of Michigan Health West, and really started to see the business of healthcare. And, seeing the business side and then seeing the experience side as a clinician, as a nurse, really was just like, why are we doing what we're doing, and why are we strategizing the way we're strategizing? And it really started opening my mind up to say, if the ER is this critical access point and there's all these primary care needs out there and really needs to manage disease processes better and promote better health, why aren't we doing more of that? And it's kind of what the origination of the idea for Baar is, I saw as an industry kind of trend, the consolidation of healthcare, how you have all these organizations merging together and really critical access points, rural hospitals, and these different office settings reducing for more business purposes in healthcare, and how do you streamline expense? So I was like, we need to reverse this trend. We really need to do more of a decentralization of healthcare and get it back to that brown bag, doctor with a brown bag going to your house mentality. Is how do we take healthcare and bring it back to the people? Whereas I feel like healthcare as an industry has been taking away from the people, and it's this reactionary model. Is how do we get more of this proactive model of healthcare services? And so I really, really just wanted to take that as a central concept and say, how do we push this? And then, me being a nurse myself and seeing the scope and the abilities of a nurse and really what that need is out there in the community, thinking this is the perfect blend of what's needed in an industry to a workforce that's able to accommodate it. And there are millions of nurses across the U.S. that have only traditionally worked within healthcare systems. And so how do I take the nurse and make them the entrepreneur, the business owner? How do I make them the drivers of this movement that has traditionally been physician-led? And so we're pushing those things and really just trying to utilize the business environment and the school environment to access those individuals currently, with the idea to say, how do we rewrite the scripts on an entire industry and decentralize healthcare services to bring them back to people?
So what I heard you say was the centralization has led to is led to part of the biggest problem. So you have decentralization, but then that's kind of led to a reactive nature of the healthcare industry. Is that right? I mean, talk about kind of how those are hand in hand, or why those are driving that. Because I know cost is another aspect of that. Costs are going up, and you talk about businesses and schools being a source of where you guys are targeting. So I was curious if you kind of take a step back and say, okay, the problems that you see, and then what are the big pain points that you're trying to solve?
Yeah, the centralization component of it, it's really, if you look at anything, I look at this as a business owner. You say, hey, I have a certain amount of overhead expense, and I have a certain, expense to operate, and here's my personnel expense. And so you're looking at things in that organizational fashion, in that business fashion, and saying, how do I reduce my overhead expense, and how do I become more efficient? And so what I saw a lot of was, we would take our budgets in the hospital system, and we would say, hey, we have these expenses. How do we shave expense, or and how do we become more efficient, which is a good business practice. I think healthcare did that through systems like Lean and Six Sigma, and got better. But then I think it crossed over to, now you're impeding the quality of that clinical experience and really the time that provider has with that individual. And that's where I think, it kind of got to that, like, if we could just stay right here and find out this happy medium of operational efficiencies, but then quality of provider time with that individual, we could be in a really good spot. And I think it just went way past that. And then I think, unfortunately, administrative ranks within the hospital systems became disconnected from the clinical ranks. And so you started seeing this trend towards more of this business model of healthcare versus more of this patient-centered model of healthcare. And in that transition of outcome to really where you're not seeing individuals get healthier, what you're seeing is individuals become more dependent upon healthcare and more dependent upon medications and all these things. And it's, you're never going to win by doing that. If you create this dependency model, and it's kind of where we're at right now in healthcare. Sickness and disease has become so rampant because we haven't empowered our patients to take good care of themselves and to understand how to actually use healthcare efficiently. And so you see, the healthcare system become inundated and very reactionary to everything, to where our volumes are up, but we don't have enough care staff, and now we're trying to incentivize certain things, and it's this negative cycle that gets worse and worse, and it's not getting better and better. And it is, it's something happens, let's react to it. Somebody gets sick, let's give them a medication. But it's not this, you're sick, what's the core of that issue? And now let's start working with you on a one-to-one basis. But because primary care providers only have 5 minutes to see you, and they have these patient panels, and they got to fit so many patients in during the day, they just can't do what's necessary. So a lot of, I talk with a lot of, well-intentioned clinicians. They're in the system doing their work, and they're trying their best, and they're phenomenal individuals, but they just can't. And so that's really what we're trying to create with Health Baar, is this really alternate ecosystem of healthcare that doesn't put time restraints on, how long you see your provider, and that really walks alongside of you as this health coach and this lifestyle coach model. It's precision medicine. It's taking a course of action with someone's health that's tailored to their individual needs, and then walking alongside of them to help them achieve that. Not just, here you go, good luck, I'll see you in a year. It's, how do I become your partner in health, and how do I motivate you towards better health? Because at the end of the day, my health is my responsibility, your health is your responsibility. I can't make you do something that you don't want to do.
Yeah. I think it's interesting. I think two things that come to mind are, well, I would just say first, it seems like that's the logical model you would want for healthy individuals, right? It's like that you want to, instead of being reactive to so many things, or creating people that are dependent on the system, then you want people that are healthy, right? I mean, it's health care. My question is, if the driver, it sounds like his cost is a big one, and then just a reactionary nature. So I kind of want to say, like, how are you able to keep the costs low, to compete with this. If centralization, you think more efficiency. I would assume some more bureaucracy, so that adds like overhead expenses. Like you mentioned, the administrators were separated from the actual quote boots on the ground, right? But then the other is, someone that's dependent on the system is a customer that's dependent on the system too, right? To not to be too like, skeptic, of the system, right? But it's like maybe that's baked into the model. I don't know,
Yeah, I mean, from a cost containment standpoint, a lot of people, especially in healthcare, fear cost transparency because they don't want the individual to make this consumeristic decision on receiving care or not.
Yeah.
So the best way to avoid that we've found is really adopting more of this direct primary care model. And so it's a monthly style fee, kind of like you pay your insurance premium, but not that. It is a very minimalistic number, somewhere around $45 a month, to say you can have access to all of these healthcare services. So it's not a huge hit to your pocketbook, yet you get that dedicated access to a care team and a clinician that can do all of those things for you in that coaching and proactive nature. And so what you really start doing is controlling cost, because you've capped cost at that monthly premium. And it's not going to blow up into all these, we just, you came in for your CAT scan, let's just say, and then we did, we gave you this medication, and then we did this and we did that, and by the time you're done, you come out of there with a $5,000 bill, and you as the individual are like, what just happened? I feel like I was there for an hour and I just generated this $5,000 bill through facility fees and through exorbitant costs for very generic kinds of things, because that's how the billing system has been baked up in those hospitals to account for that overhead.
And does that create an adversity or a hesitancy for someone to be proactive in their healthcare? Right? It's like, screw that. I'm not going to go into that unless it's an emergency, right? I mean, does that play into that whole system and that whole?
Yeah, I mean, it's fear based. If I'm gonna, you think about it, I'm going to go and get my oil changed in my car. And if I walked into that, I drove my car into that oil change, and I didn't know what it was going to cost me, but they could bill me whatever they wanted to. So I go in there and they're like, hey, we changed your oil, but guess what? We actually changed your brakes, and we tuned up your fluids. We did all this kind of stuff. Here's your $5,000 bill. You'd be like, oh crap, I'm not going to do that again, because you might put off preventative maintenance on your vehicle because you have no idea. But if I go in there and I know I'm going to pay $65 for this, I'm okay with that. I'm good with that. There's not a surprise. I get to have these things. So there's this huge fear basis to where, and a lot of it is a lack of health literacy as well. It's one of the big things we try to hit is how do we get somebody knowledgeable on what staying healthy and being healthy is, and then how to navigate the healthcare system. So how can we avoid a lot of those fear-based things, and how do we help navigate somebody when they do have to have certain medical care rendered? So some of it's just that, to say, this is what it is, here's what to expect, here are the questions to ask. A lot of people don't ask a lot of questions when they go to see their provider because they don't know what to ask. And so having an advocate that can do that for you or coach you through that is key for a lot of individuals who interact with the healthcare system on a regular basis. So it's all those things. But yes, there's a fear basis to people accessing healthcare because they just don't get it. And that is a large majority of people. There's a very small number of individuals. I would even say clinical professionals in the industry have no idea how healthcare costs work. So for your average consumer of healthcare to understand that is not realistic in today's healthcare world.
Yeah. So who? I mean, you guys can't be the only ones doing this, or doing a movement inside of the healthcare system. Because I think just from I don't know anything about the industry other than just using it, right, with my kids and all of that. It's like, yeah, absolutely. You have these random costs. And not only the oil change example is a good example, but it's even worse than that because the bill comes 3 months later, right? And it's like, so then you're like, I don't even remember what really happened at that visit. And it's from some third party system or something. And maybe you get 4 bills. Like you have a baby and you get 30 bills and you're like, this could be a scam. I don't even know. They could just find out I had a baby and they just sent me a bill. It's like, so obviously the system's broken. The users of the system know that. They're frustrated. So it's kind of, quote, ripe for disruption is what I would say. And you
Yeah.
guys are an example of someone that's addressing that pain. Like MetaShare, I see some of that stuff popping up, getting a little more popular.
Yep.
What I assume from you is kind of like, okay, let's have a monthly cost. Let's be proactive to get healthy people, and then it actually gets better if they don't use the system because they're so healthy. If they're still paying the cost, and it's a manageable cost, and they can use it when they need it for education, right? So
Yeah.
so what are some of the other what else is happening kind of in the industry that you guys see that are answering some of these these issues that are popping up or that have manifested? Thank you for listening to the 2 Cent Dad podcast. I wanted to take just 1 minute to tell you how this show is possible, and that is through my business, EC Group. We help software companies get more done by building them amazing developer teams. Now, those teams come alongside their in-house developers to help them build more and build faster. We are a purpose-driven company, which means that we use our profits to help support nonprofit work in the locations that we operate. We operate in the US, in Michigan, and also in Chennai, India. You can check us out at teamwithec.com. Again, that's teamwithec.com. So if you're hiring software developers or you know someone that's hiring software developers, check us out. Love to talk to you.
Yeah, healthcare is a very lucrative market, especially for startups and other investors right now. So you do see a lot of different solutions being put into place. Some have existed for a while, direct primary care solutions, business-focused healthcare solutions. A lot of these, it's not a new concept in and of itself. There is definitely competition out there. You think about the total U.S. healthcare market, and healthcare is ubiquitous. Everybody needs it at some point for something. And so, population of, tens, hundreds of millions of people, organization's impact may be on, 10 or 100,000 of those. So it's a drop in the bucket. So you look at the overall change that needs to exist. It's going to take a lot of movement and a lot of different organizations to make that happen. So there are pockets of groups that are doing employer-focused healthcare on a transparently priced model. And that does exist. Our biggest difference, a lot of healthcare has been based off of brick and mortar, and it's, hey, come to me. I'm going to build a clinic, and you come to me as the patient. Not many have taken more of this concierge route where I'm going to go. It's going to be a non-brick and mortar approach, and it's going to be very mobilized. And that's something that we're specializing in, is to say we don't build brick and mortar with our structures. So own that desire to keep overhead very low and really maximize the impact of that clinician with those individuals and those businesses. So we're able to achieve lower clinician to employee ratios to really maximize that impact. A lot of these other solutions still bill insurance. They charge a monthly fee and they bill insurance for certain things. And so they're in this mixed model approach. Really what we're doing is driving this very transparent, non-insurance based market for healthcare, and really taking then, we'd say medical philosophy, and saying there's good things that have come out of healthcare. People are living longer because of certain treatments and those things, but then saying, that's okay. Well, and we're going to use that stuff, but let's put 75% of the emphasis on preventing illness and living a healthier life, and really changing the trajectory of health in an individual, not just being there to provide health care, or really being there to provide sick care to them. We're going to provide you health care, and that's, at the end of the day, that should result in you needing us less, and you being that empowered consumer of healthcare. So we're starting to put together, I'd say, more of this transparent ecosystem of healthcare delivery that's really not based on a large organizational structure, but really creates clinician empowerment, to where clinicians are creating these ecosystems in and of themselves, and these care team models, mobilizing out and managing these smaller micro units of populations. And so instead of saying we're going to build this brick and mortar centralization structure, we're going to empower clinical care teams to take care of small groups of individuals in a geographic space. And so, back to that, for me, I just have that doc in the brown bag. He lives in your community, and he's 10 minutes from where you are, and he goes to the same church you go to, or he sits down at the pub and has a drink with you. Like, that level of personalization, how do you how do you create that again and bring it back? And so, as a care provider myself, I would have, my family member sending me, pictures and text messages, what should I do? I just got hurt, or I did this, or can you come take these stitches out? And it's like, sure. Well, why can't everybody have that?
Yeah.
Why can't things that are so simple and so easy, a lot of times just need that, voice of reason in them, and not this, it's hard when you have an emergency happen or an injury and you reactionarily just go to the ER. And it's like, well, if you step back and just take a second, most of the stuff's not an emergency.
Yeah. So where do you, so extrapolating that, you look like 10 years out, you have this like marketplace, you have these, this large staff, like but not brick and mortar, but of people in the community.
Mm-hmm.
What is it, just talk to me about that. What's the dream, or what's the vision for like 10 years out with Health Bar? How are they serving the community to keep them healthier?
Yeah, I've like I said, being a nurse entrepreneur myself, I want to foster that level of independence within the nursing community. And so for me, it's 10 years out. How do we make this ecosystem look like these care teams living where they live and networking with other care teams, but then connecting on best practices and connecting on what's working and what's not working, and then them just going to individuals' houses, them going to places of employment, to schools, to all over, and saying, how do we do it in that geographic distribution, to where you have a care team in this community and a care team in that community, and they're just taking care of people, and that can happen in an infinite number of locations. Ideally, we're creating the baseline and the framework of this model that everybody always asks, okay, you're doing great work, how do you scale? And I think when you try to control scale in certain ways, or try to build to a scale, it becomes so complex and so burdensome and costly that a lot of businesses find limits with that. Whereas ours is, say, what if scale looked like reduced overhead, and scale looked like reduced complexity and control, and this was not only an empowerment model for our patients, but an empowerment model for our clinical community, to say, you became a clinician because you had a desire to take care of people. What if I gave you the opportunity to do that and create, through that, better health to achieve that meaning and purpose in your career? And so, I see a nurse and a nurse practitioner teaming up in different communities across the U.S. and really saying, I'm going to take care of this population of individuals. I'm going to provide them education, I'm going to provide them care, I'm going to provide them coaching, and I'm going to be their advocate, and just take that and just replicate it everywhere.
That's awesome. So shifting gears a little bit, tell me about building this startup while having young kids. You have 3 young kids. I think they're all like under 8, 9 years old, right?
8, 6, and 4
Yeah, 8, 6, and
currently,
4.
but
Awesome.
I feel like that adjusts faster than I can keep up.
Yes, amen. I feel that.
Yes.
So tell me about that.
Yeah.
Tell me about that journey and how you've managed that, because I know what you're trying to take on, a pretty monumental task, and what you guys are trying to do with Health Bar. You've been pretty successful so far here in West Michigan. I think out even beyond that. So tell me a little bit about some of the struggles and how you managed it.
It's something I've tried to keep an eye on my whole career, is my professional commitments to my family commitments. I'm a firm believer if you can't be healthy at work if you're not healthy at home, and so it's continue to not lose focus on my wife and our 3 amazing children, and being a part of their lives. There's definitely seasons, especially building a business, where you're digging in, and no, you can't be home for every family dinner, and no, you can't be around for all these things, but not making that the regular occurrence and making that more of the exception has been a huge focus. To say, there's right now I got to dig in and I got to get this stuff done, but it's always working to have that be the exception. I can't make this the consistent lifestyle that has, I think, consumed a lot of entrepreneurs and individuals and startups. It's one night that turns into 2 nights, that turns into 5 nights a week, and it overtakes you. So some of it is setting limitations to say I'm going to say no more, understanding that a lot of the stuff that you say yes to is unnecessary. So I had to get really good at kind of triaging my own time and to say what's really value added for me in building this business versus what's just kind of being out there doing stuff, and then becoming very efficient with my time use. So I think people don't really realize how much time is spent just not being productive, and so trying to really be productive with the hours that I'm working. And um, and so sometimes, I mean, what I've done is we use EOS as an
Mm-hmm.
system, so the entrepreneurial operating system, and it's a big focus on taking clarity breaks and time to really focus and have good mental health through all of it, so that what you build is sustainable. Because nothing, you can go hog wild for 2 years, and then what do you have to show? Maybe you have a business, but if you crumble as a leader or as an individual in that, in your business, you're the cornerstone of that business, your business will crumble. And so it's saying no to some opportunities. Even say, you know what, now's not the right time because we're just not going to be ready and okay for this as a team. So it's just I think just being aware, quite honestly, of what I need to succeed and what those potential failures are, and then taking time to really sit back and consider those. But it's, for me, family's first, and so you can always make money somewhere
Yeah.
else. There's stuff out there, and no job is worth me compromising that. So I think for me, just making sure I maintain what my North Star is, and not losing focus on that. And then, like I said, if the other stuff's not okay, then that's not okay, and I'll figure it out. It's not gonna, change my purpose or my mission. But it's not worth it
Yeah.
if it's not, if my family's not healthy.
Yeah, definitely. I feel the same way. And I think when you said, there's things that are necessary maybe for a time or, occasionally, but
Mm-hmm.
there's a lot of stuff that you can commit your time to that really doesn't move the needle, kind of that 80-20 principle.
Mm-hmm.
You
Mm-hmm.
mentioned EOS, and like we use that too at EC Group, but and I found it extremely valuable. I'm curious how your time in the emergency department helped you build some skill sets, because you talk about triaging your time. That's a medical term, right? So it's like, but I
Yeah.
think
Yeah.
it's an apt
Mm-hmm.
analogy, because when you have kids and you got a full schedule, it's like you have to do that. You have to protect it, and you have to
Yeah.
focus on the important things. So do you feel like that
Yeah.
prepared you? I mean, talk about that a little bit, maybe.
Yeah. Yeah, I love it. Yeah, I will use interchangeably a lot of medical terminology. It's like knowing two languages, and you just kind of mix them together when you're talking the
Yeah.
same kind of idea. But yeah, one of the things I 100% think, yes, that time in the ER did help me in that prioritization, because one of the first things we learn as a clinician, as a nurse, when you're saving someone's life, three things: airway, breathing, circulation. So it's like, does someone have, can they breathe? Um, do they have an open airway? Can they breathe? And then is their blood circulating through their body? And you need that to survive. And those are those three basic concepts. Everything else after that goes by the wayside. So working in the ER, we would train for mass casualty incidents and a lot of the bad things that can happen. And so when you hit a certain moment of maximum output, you got to start now saying, all right, how do I now go to those core things? And if I have 100 people who need life sustaining things, how can I hit these three things for everybody? And there could be detrimental outcomes to other parts of their body, but as long as they're alive at the end of the day, that's what makes the difference.
Yeah.
And so you just got to know what resources are available to you, and when you're overwhelmed to the point where you can't do everything, you got to start prioritizing, and that helped me significantly. And then those snap decisions too, and being okay with, like, it's a huge mental burden to come up, when you're not in crisis mode a majority of the time. And so you're so geared towards taking care of everything and doing it perfectly. But then you have to be able to mentally switch to that crisis mode of, I got to prioritize now. And there's going to be things that do fall by the wayside, and you have to be okay with that. It's one of the hardest things for a clinician to, especially in that emergency department setting, to be okay with, because it feels so counterintuitive. You're like, but I got to do all this stuff because it's what we do all the time. And
Yeah.
it's like, but no, but now we're focused on maximum outcome of the most critical things. And same thing as business. It's a great analogy. to say there's times in the business where we're focused on these critical components because we are so overwhelmed, just because we need to keep the ship running.
Yeah, absolutely.
Mm-hmm.
Yeah, business, life, family, it's all in today's society, or I mean, it's probably been this way for a while. You always say this, today's society, but it's like there's so much you can do. There's so many things that are pulling you in different directions, that being the ultimate triage, person in your life is really important. So
Yeah, for sure.
So where can people find you? Is it what's the website, and how can they find out more about Health Bar?
Our website's healthbar.com, and a lot of our information's on there, ways to contact us, our phone number, email address. I walk around in scrubs all the time, so if you're in the West Michigan area and you see a guy walking around in scrubs, it might be me. So pull me aside and have a conversation. But otherwise, our website's the best way to get a hold of us, healthbar.com.
Awesome. Thank you. Well, Nate, thank you for being on, man. I appreciate you sharing a little bit about Health Bar, kind of what you guys are doing, where you're going, and thanks for spending the time with me.
Yeah, no, I appreciate the opportunity.